this, but awesome. Okay, welcome back from exam 3. I am going to grade the Scantrons at 2:15 is when my appointment is. I've already hand graded all of the short answers, so your grades will be in at some point tonight. I graded the online exams, and the average for that was like a 71, so a little bit lower than the last exam. But on the last exam, the online average was a lot lower than the paper average. So that doesn't mean that yours will be the same, just because a lot of people get down to those last math questions and run out of time trying to write on the little like transcript thing on Proctorio. So I'm expecting a higher average, probably around like a 78 again. So good job. Got that knocked out of the way. And so now we have exam 4 materials. So we'll have we'll have this discussion and one more before exam 4. And then if you're content with your grade after that, you're pretty much done. You'll still have the reading quizzes, but you will pretty much be done with having to worry about studying really hard for the exams and all of that. But yeah, so kicking off exam 4, we have respiratory system. So we're hopping into the respiratory system for this section of the class. So let me share my screen. And I'm recording this just so I can post it for those who weren't able to come into class today. And thank you for everyone who did. All my online people, class has gotten really small, so don't be afraid to come back in person. It's only 50 minutes. But alrighty, so let's see, presenter mode. Hopefully this doesn't cut off half my screen. For some reason it does that sometimes. Alrighty, so discussion 9 out of 12, we are almost done. So today we're looking at spirometry. So before we hop into the actual questions, I'm going to do, as usual, a little overview of the respiratory system, what spirometry is, and then we'll look at a spirograph and look at the different values that we have. So this is looking at the respiratory system right there. And the main thing to notice here is that we have all of these paths and tubes and, things that lead into the lungs. So we have like the nose, the mouth, where air will be conducted. And yeah, that door is really complicated. You have to like push it down and then pull it in. Try that. Hey, there we go. Awesome. But yeah, so we have all these, structures that are conducting air into the lungs. So where gas exchange, which is the whole function of the lungs, actually occurs is in these tiny little structures at the very bottom of the airways called alveoli. So the alveoli are where gas exchange actually occurs, and they're kind of like the functional unit of the respiratory system. All the other structures involved are just dealing with conducting air into the alveoli. All right, so this is what a spirometer is, kind of what our entire, discussion worksheet is looking at today. And so I don't know if you have ever tried one before or used one or anything, or seen one used, but what it is this tube connected to this weird, thing here that will produce this kind of graph. So the person conducting the test will tell you to breathe in some specific pattern, like breathe really hard or breathe in, the biggest breath you can, or breathe normally. And it's going to kind of move this weight that's in this water. There's a bell inside of here. And we'll go way more over the functional, aspects of the spirometer in lecture. But for now, just know there's like a bell in water. And whenever you breathe, it's moved and it creates this type of graph. So it's kind of like an EKG, except it's not looking at heart function, it's looking at lung function. So it's kind of the EKG of the respiratory system. So this is what I think the word for it is spirograph, but I need to double check on that. But this is what that reading is going to look like. So here they're telling you to just breathe normally. So that's what we call tidal volume. This is just kind of like normal breathing. Here they would tell you to breathe out as hard as you can. So you would breathe out super hard, and that's called expiratory reserve volume. One thing to notice here, and we will see this kind of on this graph that's on the discussion worksheet. It's just a little different looking. But one thing you can notice is that there's this other volume called residual volume, and it's about 1,200 liters. That is volume that will always stay in the lungs. So residual volume, if it's less than 1,200 milliliters, then that's going to signify lung collapse. That's really bad. That's going to show that your lungs, you can think of them as a balloon. If all the air comes out of the balloon, it's really hard to reinflate it compared if there's already air in there. It's easier to inflate it and deflate it, but whenever it goes all the way down, that's really bad. So we don't ever want our lungs to fully collapse. So that's what the purpose of the residual volume is, keeping some, pressure in the lungs so they don't fall in on each other. So we have tidal volume. Then once we move past those two, they'll tell you to breathe in as hard as you can. So and that is inspiratory reserve volume. So inspire, reserve volume, inspiratory reserve. And that's kind of like the max volume that you can inhale. So whenever we're looking at spirometry, we'll have 4 volumes and we'll also have 4 capacities. So capacities are kind of looking at more than one of the volumes. So with inspiratory reserve volume, it is that inspiratory reserve, capacity, inspiratory reserve plus that total or that tidal volume. So it's looking at the max air that we can inhale, including tidal volume. So a normal breath is tidal volume, and then they tell you to breathe on top of that. That's what we look at for inspiratory reserve. Vital capacity is looking at the total amount of air that we can voluntarily move in and out of the system. So we can breathe out this far, we can breathe in this far. So it includes all 3 of those volumes except for the residual volume. Functional residual volume is looking at the volume that should be, capacity is looking at the volume that should be in the lungs when you're just breathing normally. So this is normal breath right here. That's how much should be left over in the lungs is functional residual capacity. So when you're breathing normally, the volume should be matched up to functional residual capacity. And then lastly, total lung capacity is looking at all 4 of them combined. And it's just showing us how much air is in the respiratory system as a whole. So total lung capacity is that entire volume, which is about 6,000. Alrighty, so now actually hopping into the worksheet. So I forgot to add animations. I need to do that, this is that chart that is on number 1. So we're looking at the lung volume or capacity. So volume or capacity. The value, it's not too important to memorize these values. They're kind of just there to give you an idea of okay, inspiratory reserve is pretty high compared to tidal volume, which is pretty low. I wouldn't make note cards over these, memorizing them. They're just kind of a visual. And then the description is pretty important. So number 1, we have that tidal volume again. It's sometimes called quiet breathing. So if you ever hear Dr. Chang refer to quiet breathing, he's talking about tidal volume breathing, just normal breathing. So inhale, exhale, inhale, exhale. Then they tell you to take a really big breath in so we can determine how strong your lungs are. And so 2 is that inspiratory reserve volume. So inhale, inspire, that is number 2. So that big breath. Number 3 is, so you breathe in and then they tell you once you breathe in to breathe out super hard. Get all the air out of the lungs that you can. That's going to be the expiratory reserve volume. So expire, ERV. So the max amount you can exhale. 4 is that residual volume. So this area in here, that's always going to remain in the lungs, about 1,200. So that should always be in there. And then, so those are the volumes. So the volumes are very specific. Then when we get into the capacities, that inspiratory capacity is the bottom of tidal volume all the way to the top of expiratory reserve volume. So here to here is the max amount we can inspire. 3 and 4 is looking at that functional reserve capacity. So how much that should be left over in our lungs when we're just breathing normally. So from the bottom of normal breathing or tidal volume to the top of residual capacity. 1, 2, and 3 are showing us vital capacity. So the amount of air we can voluntarily move in and out. So we can voluntarily pull that much in and pull that much out. And then lastly, total lung capacity is all of them. So from the tip of 2 down to the bottom of 4, that's showing us the total amount of air that we have in our lungs. So yeah, that is what we are looking at when we are looking at a spirogram or a spirogram. So I would definitely be able to label this. I would know which volume is each, which capacity is each. So if you take like a colored pen and kind of draw over the different ones or something, make sure you understand these and what each of them means. Alrighty. So hopping into the actual first question. So there are 2 main zones that we look at when we're looking at the respiratory system. We have the conducting zone and the exchange zone. In this class, we're going to be most focused on the exchange zone because that's where this, the physiology actually occurs. The conducting zone is all of this from the nose or the mouth that conducts air through all these tubes into the alveoli. So the exchange zone is the alveoli, and that's where we actually have the exchange of carbon dioxide and oxygen. So you breathe air in through either your nose or your mouth. It travels down all of these structures, the trachea, the bronchioles, the bronchi, the bronchioles, and then we hit the alveoli. Now, in way more specific classes, the bronchioles do deal with some type of exchange with gas exchange. But for this class, we're just focused on the alveoli. So don't worry about knowing that some of the bronchioles, like the respiratory bronchioles, deal with exchange. This class just focused on the alveoli being in the exchange zone. So the reason why the alveoli are the only structures that deal with exchange is because the other ones are just too big. The trachea is huge and it has many layers of tissue. It's going to have smooth muscle tissue. It's going to have that thick cartilaginous tissue that keeps it open. Same with all of these other structures. The nose, the mouth, they all have smooth muscle tissue. And we just want that really simple layer of endothelium so we can have that simple diffusion of oxygen in and carbon dioxide out. So the alveoli are just like this simple layer of endothelial tissue surrounded by capillary beds. And capillaries are where we see gas exchange actually occur. So what we call all of those structures before the alveoli right up here are the dead space. So, air still remains in them so they don't collapse, but it's not being used for oxygen exchange. It's just kind of sitting in there. And so we call that dead space air. So if we breathe in about 500 milliliters of air, not all 500 is going to reach the alveoli. Just a little bit will, and the rest will remain in the dead space. So dead space luckily has a really easy conversion factor. So for every pound of body weight, there will be 1 milliliter of dead space. So if you weigh 120 pounds, you'll have 120 milliliters of dead space. If you weigh 200 pounds, you'll have 200 milliliters of dead space. So that's kind of how you can estimate how much volume is in specific people's dead space. So question 2, we're going to use all of that knowledge that we've learned so far and apply it to some calculations and estimations. So let's hop into part A. So we're looking at an individual who is 120 pounds with a tidal volume of 400 milliliters and an expiratory reserve of 0.8 liters. So when we are looking at a normal breath in the volume that is being inhaled, that's going to be 400 milliliters. So this is where it's important to know that tidal volume is normal breath. So normal breath, same thing as tidal volume, quiet breathing. Those are the 2 things you want to match up with every time you see tidal volume, normal breath or quiet breathing. And that tells you how much volume you are inhaling on just a regular inhale and exhale. When we look at how much of that air will stay in the airways and not the alveoli, that's going to be 120 milliliters, because remember, for every pound of body weight, we have 1 milliliter of dead space. So you can see he or she weighs 120 pounds. That means we're going to have 120 milliliters of dead space. And if you wanted to calculate the percentage, you would just take 120 over the normal breath to notice that, okay, 30% of air is remaining in those airways. How we get how much air enters the alveoli is we just subtract that 120 from that 400, which leaves us with 280. So we know we're normally breathing in 400, and we know that 120 milliliters of that is going to remain in the dead space. That's going to tell us how much is actually entering the alveoli, which is 280, so about 70%. So it's a 70-30. 70 kind of remains in the in the 70 actually gets absorbed, whereas 30 remains in the dead space. So part B is kind of looking at the exact same thing, just worded a little bit differently. So when we inhale that air, or when we exhale, the air that's in the dead space is the first to be pushed out. So our lungs, they are kind of muscular, they push air out more as the diaphragm and the intercostals on the ribs. But that air that's in the trachea and the dead space will be the first to be removed. Therefore, the last little bit of air in our alveoli will be the air that's going to replace and fill that dead space. So we have, that air down here in the alveoli. When we exhale, this air in the dead space will be pushed out. But remember, we never fully clear the lungs or the airways. There's always going to be air left in there. So that 280 will kind of move into the dead space, and that 120 milliliters moves out. So the air that is oxygen depleted is, the volume is 120 milliliters. That's that air that remained in that dead space. And then the volume and percent of the air that is well oxygenated is that 280, about 70%. So yeah, just another way of asking that same previous question. Alrighty. So last part of this question, we're looking at what happens to the environment of the alveoli in the lungs from one breath to another. So on average, about each breath, we absorb about 70% of oxygen. Note that that's about 160 millimeters of mercury. That 160 is about 20% of the average atmospheric pressure, which is 760 millimeters of mercury. So at sea level, the average pressure in the air is 760 millimeters of mercury, and about 20% of that is oxygen. So in the air that we're breathing right now, there's about 80% nitrogen, 20% oxygen. You don't need to know this, but just in case you're like, isn't there carbon dioxide in the air? There's about 20% oxygen, about 79.4% nitrogen, and about 0.6 to 0.4% carbon dioxide. So there's very little carbon dioxide in the air. Oh, sorry, I thought you had a question. But yeah, but for this class, just know 80% nitrogen, 20% oxygen. So whenever, that remaining air is oxygen depleted, about 30% when we breathe in. So here's how you can kind of calculate the pressure inside of the lungs whenever we inhale. So you would take that average 20% of oxygen in the air, multiply it by 70%, that's actually absorbed, take the oxygen depleted, multiply it by the 30%, this is the air staying in the dead space, and that will give you the pressure of the lungs. So our lungs stay at like 124 millimeters of mercury. So what we see is that overall, this is a bunch of like word blah. The main thing that you want to just know here is that each breath, the environment in the lungs is not going to change that much at all. So the main thing that Dr. Chang wants you to take away from this slide is that the lung environment is very stable. It keeps us in homeostasis. We don't have many changes of like chemicals or ions in our lungs. It's always going to be about 13% or 87% the same. Only about 13% of the air is being replaced each breath. And so it's going to remain almost 90% the same environment. And that 10% is normally going to be the same per each breath. So the main thing to take here again is just that our lung environment is relatively stable. It changes about only 13% per breath, and normally it's not even that much. So, yeah. All right, so lastly, last question, there are 2 formulas that you do need to memorize for exam 4, and these are those 2 formulas. So you're going to want to have these memorized for calculations on exam 4. So the first one is looking at total pulmonary ventilation, and the second one is looking at alveolar ventilation. So alveolar ventilation is looking at how much lungs we are actually, or how much air we're actually absorbing and getting into those alveoli. Total pulmonary ventilation is looking at how much air we're bringing into the entire respiratory system. So you can see the formulas are almost the same, except alveolar ventilation subtracts dead space. So it's just looking at the air that gets to the alveoli, whereas total pulmonary ventilation is looking at the air in the alveoli and the dead space. So whenever we calculate this out, you take the given breath rate or the respiratory rate, multiply it by the tidal volume, which we were given in number 2, and that will give you total pulmonary ventilation, whereas number 3, alveolar ventilation, same equation, except you subtract that dead space air. So alveolar ventilation is always going to be smaller than total pulmonary ventilation. So alveolar ventilation, the value will always be smaller than total, because again, total is looking at the dead space and the alveoli, where it's alveolar is looking just at the alveoli. All right, so that is all I have for y'all today. Discussions are getting more specific, so they've gotten shorter. We don't have as much to discuss, and we haven't hit this in lecture yet, so we're not getting too far into it. But yeah, that's all I have for y'all. So I'll take any questions or go back to any slides if y'all need me to. And if not, y'all go enjoy this weather. It is so nice and it never lasts in Texas. So go make the most of it. Y'all ever go to like parks or anything, or where's a good place to go?
I personally like going to yes.
But no, yeah, okay. I've never been there. And my mom yet. Okay. Okay, yes. I might go there tonight just because this weather is so nice. Yes, I have a cat stroller. I'm gonna put like my cats in it and like bring them outside. Oh my God. Bye.
I did have a question.